Welcome to the Health Plan Management System, also known as HPMS. HPMS is a secure, Internet-accessible information system maintained by the Centers for Medicare and Medicaid Services. Over 60 HPMS software modules support the business operations of the Medicare Advantage, MA, and prescription drug, Part D programs. Through these automated solutions, CMS strives to streamline business transactions for our private partners as we work together to provide Medicare beneficiaries with a diverse set of high-quality healthcare options. Welcome to the Formulary Submission module in the Health Plan Management System, HPMS. We will demonstrate how to submit a formulary and supplemental files in HPMS. Please be advised that any information disclosed or discussed during this training will not modify or supersede any regulations, manual provisions, or other written guidance issued by the Centers for Medicare and Medicaid Services, CMS. The Formulary Submission module in HPMS enables Part D plans to submit formulary files for a contract that contains all or a subset of drugs using the CMS-provided Formulary Reference File, FRF. The Formulary Submission module can be accessed within the Plan Formulary section on the HPMS primary navigation bar. The formulary submission process contains a series of web pages that will collect information from the plan organization. Please note that prior to beginning the formulary submission process, you must ensure that the formulary contact information in the Contract Management module in HPMS is completed. This video is a brief demonstration. For information and troubleshooting assistance, refer to the formulary instructions available under the Documentation section. Accurate formulary submissions are essential. Formulary submissions are based on RX CUIs. Only RX CUIs listed in the FRF will be considered valid submission codes. The FRF and the detailed layouts of all the submission files are available under the Documentation section. Select the Formulary Submission menu item, which takes you to the Formulary Submission Start page. Select the appropriate contract year from the Collapsible Navigation menu. Select Submission File Layouts link under Documentation. It is imperative that the files you are uploading be in the following format. For the formulary file, prior authorization file, and step therapy file, use the ASCII2 tab-delimited text file format. During the initial submission period, the value of change_type field must be add all records in the file. Quality assurance checks on the initial formulary submissions must be performed to prevent errors from occurring. To submit a new formulary file, select the Plan Formularies drop-down from the HPMS top navigation bar. Then, select the Formulary Submission menu item, which takes you to the Formulary Submission Start page. Select the appropriate contract year from the Collapsible Navigation menu. Select Submit New Formulary from the Formulary Submission Start page. On the formulary plan type, indicate whether you are Medicare/Medicaid plan and select Next to go to the Associate Contracts to the formulary. Select one or more of the contracts listed on the Associate Contracts to Formulary page to associate with the new formulary. Select Next to go to the Formulary Information page. The Formulary Information page collects information about your formulary submission. If you have a previous year formulary ID that you want to closely resemble, select it from the drop-down if available. Otherwise, leave this field empty, as it is optional. Enter your formulary name, indicate the formulary classification system, define the number of tiers, select Yes or No for the following. Provide OTC as part of step therapy protocol status, quantity limit status, limited access status, prior authorization status, and step therapy status. Select Next to go to the Formulary Tier Information page. On the Formulary Tier Information page, select the number of tiers within the formulary tier model, and then select Next to go to the Formulary Submission Upload Files page. The Formulary Submission Uploads Files page allows you to specify the formulary file, prior authorization file, and step therapy file you want to upload. During the initial submission, submit a full formulary file and full prior authorization step therapy files, if applicable. Select Upload button to go to the Verify Submission page. On the Verify Submission page, verify the information you entered during the submission process. Once verified, select the Submit button to go to the Submission Confirmation page. The Submission Confirmation page confirms successful receipt of your submission and provides the unique formulary ID assigned to your submission. This page will also generate an email to all formulary contacts and the formulary upload contact identified on this page, acknowledging receipt of the submission and the assigned formulary ID. After receiving your submission, HPMS will perform a series of validation edits. At the close of the validation process, a follow-up email will be sent to the designated formulary contacts. This email will indicate that the formulary was successfully validated or identify errors detected during the validation process. If errors were detected, the formulary submission will be rejected. These emails are also available in the Formulary Status History Report. To check the status of the formulary submitted, select the Plan Formularies drop-down from the HPMS top navigation bar. Then, select the Formulary Reports menu item. This will take you to the Formulary Reports page. On the Formulary Reports page, select the appropriate contract year from the collapsible navigation menu on the right side of the page. This takes you to the Report Selection page. The Formulary Reports module provides various reports related to formularies submitted. Select the Formulary Status History Report on the Report Selection page and then select Next. Select the Formulary ID on the Formulary Status History Report parameter page and select Next to go to the report. The Formulary Status History Report provides detailed status information about all versions for a given formulary ID. The report also provides access to the email sent out from HPMS. To view the email sent regarding the formulary and PA/ST file upload, select the link provided under the Formulary Status link. As part of the formulary submission process, you are required to submit certain supplemental files depending on what is included in your bid. Organizations must submit supplemental information for all the plans offering this coverage. The supplemental files cannot be loaded until the organization has successfully submitted its related bids and the bid has migrated into desk review in the HPMS system. Once this has occurred, the required supplemental file gates will automatically open for submission of the required files. Only one supplemental file version may be submitted for each file type per formulary. However, it is not required that all plans associated with a specific formulary offer supplemental coverage. As mentioned earlier, the detailed layouts of all these submission files are available under the Documentation section, which can be accessed from the Formulary Submission page. The video provides an example of uploading one supplemental file, the Free First Fill. Select Submit Free First Fill file from the Formulary Submission page. This takes you to the Free First Fill Supplemental Files, select a formulary page. The Free First Fill Supplemental File, select a formulary page contains a list of all formularies that require a Free First Fill file. Note that only one formulary can be selected at a time. Select a formulary for which to upload a Free First Fill file and select Next. This takes you to the Free First Fill Supplemental Files, Upload Supplemental File page. Please note that only those plans with bid submissions that offer this benefit will be displayed. Plans that are linked to this formulary but do not offer this benefit will not be displayed as the supplemental file submission is not applicable to them. Enter the name of the Free First Fill supplemental.txt file you wish to upload and select the Upload button to go to the Free First Fill Supplemental File Verify page. On the Free First Fill Supplemental File Verify page, select the Submit button to go to the Free First Fill Supplemental File Submission Confirmation page. Select OK button to confirm submission. While the instructions demonstrate how to submit the Free First Fill file, you can also use these instructions to upload the additional demonstration drug, partial gap coverage, home infusion, value-based insurance design, excluded drug, and over-the-counter files. The steps taken to upload files are the same for each supplemental file type. The Status History Report, Free First Fill, under Formulary Reports, provides detailed status information and displays the email sent for all submissions for a given formulary ID or contract ID. For more information on HPMS, please visit our public website page. You can also contact the HPMS Help Desk at either hpms@cms.hhs.gov or 1-800-220-2028. Thank you for taking the time to learn about the Health Plan Management System. Please check back here for additional videos on HPMS functionality. Brought to you by the CMS Center for Medicare, Medicare Drug Benefit and C&D Data Group, Division of Plan Data.